Okay, so we look at two factors here that are very important in biopsy. So if I want to take a biopsy, the first thing I'll do is to identify where I need to take this biopsy. Second thing, I'll have to plan on how to take the biopsy. Do you understand? So that's the basics of biopsy site and also what biopsy approach. So what we have here is this. It just refers to you are trying to look at the location where the tissue is taken, where the tissue is to be taken. Then also what the method you want to use and what obtain it. So general principles, site selection depends on what biopsy you need, right? So choose the site based on the clinical suspicion, what you need. Target the most part that will give you the best results. Okay. Avoid necrotic or scarred tissue when possible. So approach selection, you want to look at the safety of the patient. You don't want to compromise other things. You want to minimize bleeding and all of that. Okay. So common biopsy sites in orthopedics, that's when you have all those long bones on the femur, on the tibia, on the humerus. You could occur in the joints, in the synovium. Okay. You can want to take it in soft tissues. You can want to take it in lymph nodes to access, all those maybe things spreading around and all of that. So biopsy approach, you can do the fine needle aspiration, and this should be a fine needle aspiration, right? So you just aspirate things in that needle and everything is fine. You can do the core needle aspiration, where this one is to retrieve what the tissue cores. Then incisional biopsy, this one are basically what incising the skin, to remove a portion of the lesion. Of course, you need a bigger sample for this, So for the reason of the biopsy, you actually determine which type of biopsy to come in. Then also excisional biopsy, where the entire lesion is removed. Then also open biopsy, which will be performed in the operating room under anesthesia. Calculate.